David, thank you for joining me today. I wanted to give the people watching here just a chance to hear from a local Cincinnati emergency room physician. You're obviously at the front lines, and a lot of people have been watching the news and hearing from national people, and so I thought it would be interesting for people to get a chance to hear from you, your perspective, what you're feeling, thinking with all this. I'll let you kind of give a brief intro. You'll be able to do that better than I do. But will you just tell us a little bit about the department you work in and kind of what your role is?
So I'm an emergency physician. I work at a hospital system and I work at a large academic medical center as well as a smaller community hospital. And my job is mostly doing clinical work, but I also have some administrative duties within my department.
Okay, got it. Great. Thank you for that. And so Cincinnati obviously is has not we don't compare at this point to some of the other epicenters in terms of our exposure to COVID-19. But what are we doing at this time? What is your hospital doing to prepare for COVID-19?
Well, this has been going on for some time in the background, and I think it really started to get real in early March. We started to have an awareness of it. We heard about it in China, and then it started popping up in the United States, first in Seattle, I guess. And so I remember coming to work in early March and it being the main topic in everyone's mind. And it just sort of followed the flu season here. And so we went straight from seeing patients with influenza to thinking about whether this was something that was here or not. And it's sort of been an evolution because we really weren't ready for it, in the sense that this is a rare new disease that, to begin with, we didn't even have testing for it.
Mhm.
We didn't really know what the symptoms were, and we didn't really have an organized response as a country, as a state, or as an individual hospital or healthcare system. So over the last several weeks, we've changed a lot, basically on a day by day and even an hourly basis.
Hmm.
We've been making changes. Um, the big changes that we've undergone is both of the hospitals I work in have split our emergency departments into a respiratory side as well as a non-respiratory side. And so if patients come in with either fever, cough, or shortness of breath, they get triaged to the respiratory area. And those patients are cared for at a higher level of protective equipment by the staff. And then patients without those concerns go to another area where we still wear protective gear, but it's not as much. And here in Ohio at this point, I think that the overall volumes of patients coming to the hospital are down because people are following guidelines to stay home, and most hospitals have canceled all elective surgeries and most elective care. And so the hospitals just aren't very busy right now, but I think that we still feel like this is sort of the calm before the storm, and what we're seeing in New York and other areas heavily hit. We could get there in Ohio, but we think it's a few weeks out. Right now, the estimates that I'm hearing predict late April to early May as being a peak time for us to start seeing that. And so we're building capacity. I think it was wise that our state began a shelter in place order a few weeks ago. I think people have followed that mostly, and it's stopped this from being as bad as it otherwise would have been.
Yeah.
But we're doing a lot of planning for different levels of severity. So right now it's relatively mild, even though it's the main thing on most people's mind. But for example, we have created surge capacities within the hospital where we can accept more critical care patients and patients on ventilators than we used to. And we're also looking for large event spaces within the city
Hmm.
where we could have overflow patients go, whether they're coronavirus patients, or maybe take all the non-coronavirus patients and take them some other location rather than in the hospitals.
Yeah, got it. Interesting. And I'm glad you brought that up as far as how you're dealing with the COVID or the respiratory patients versus others, because I know, I mean, with my young kids, my wife and I have joked that we feel like it's only a matter of time with us being at home so much and everybody being cooped up. It's only a matter of time before we have to go to the emergency room for a broken bone or something like that. But we're all sort of hesitant to take them in just for a relatively routine thing like that you would typically not even think about. But it's nice to know that if you go in, there's a separate location for those people that don't have any respiratory issues, whatever, so that we don't have to worry about being infected if we go in, or at least not as much.
Well, yes, the patients that are coming to the emergency department these days are two groups. One are patients with emergencies, maybe a broken bone, a stroke, a heart attack, that kind of thing. But then the other groups are people with concern of coronavirus. And most of those patients are well and not sick and don't require hospitalization. And some of them are sick and might have coronavirus or a significant respiratory problem. And those patients we are often admitting to the
Got it.
hospital.
Okay. Yeah. Yeah. So one thing that I wanted to ask you about is I'm just interested to get your perspective on what you think when you see some of the things on the news. We've all seen on the news people, doctors from New York City that are sharing their story, sharing how difficult it is up there, and that they're just being run over by this and by the number of patients. And for me, as just a regular person that's not a doctor, that strikes fear in me. But I wonder how, as a physician, you would obviously be on the front lines. What are you thinking and feeling as you hear those stories?
Well, I can relate to those stories because I went to medical school in New York, and so I'm familiar with many of those hospitals, and I'm part of groups with emergency physicians in New York City, and we all do the same job and we basically care for the same groups of patients. So I can relate in the sense that that could easily be me. I'm glad that it hasn't happened yet here, but it could get that way here in a few weeks. And we don't know. I guess every day that it's not busy here, I am thankful that that means that patients are staying alive and things here locally are doing okay. But I'm sympathetic and I feel bad. I mean, if you take it, it's such an odd situation in the sense that this is a disease that is new to us and is largely invisible unless you're seeing it a lot.
Right.
And so it's almost hard to wrap your mind around. But if you take those, all the fatalities and stuff and added them up, if they were all in one location, that would be, just completely overwhelming, and the numbers are huge. But people here who just are going about their business and have to stay home from work or are losing income or are entrepreneurs or run a small business, they're suffering and it could be hard to keep in mind the value of this shelter in place or closing down on essential businesses. So
Right. Yeah.
basically, I'm very empathetic to what's happening in other locations, and I'm glad that it's not happening here yet. But we could get there. I don't know.
Yeah, yeah. Well, it sounds like what I hear from you as far as like what you're thinking and feeling is it echoes what I've heard from other physicians or other people when they deal with disaster type situations, or even if it's within your own family, you kind of, to the best of your ability, turn off the emotion side and you just get down to business and get down to the work. And I think that for that reason, it's people on the front lines that are going in there, obviously, with lack of, or at least they're putting aside their concern for themselves, and that obviously is very commendable and admirable, and so that's really neat that you have that perspective, and we thank you for that.
I don't think, there's been a lot of discussion about this in physician forums and things like that, and I don't think that it's one thing to go to work and to do our job, but it's another thing to take unacceptable risks and take risks with your exposure and things like that. And so, you know, a lot of people are saying that you have to protect yourself first. You can't just be gung-ho and rush into a room and not take steps to protect yourself. And I think everyone agrees that that's not okay and not acceptable. And I think that in a best case scenario, what's happened here is that the measures that have been taken on a large scale by our state are having an impact, and we're, quote, flattening that curve. And that, you know, if all these patients showed up in one day, it would be an absolute disaster. But because we've had time, we've had the ability to plan, to do surge planning, to get more equipment to arrive to our hospital, and we'll be better prepared. But these epicenters, these early epicenters, they weren't ready, and that's a tragedy. And it's not their fault per se, but
yeah, and you're highlighting the need for PPE, it sounds like, and hopefully we catch up in terms of production with the need here very shortly.
Well, the big thing in the news yesterday was about masks, and should everyone wear a mask in public everywhere? And that's a very complicated issue. And I think that if it wasn't an issue of limited resources, if there were plenty of masks everywhere, then it'd be a no-brainer just to say, yeah, everyone should wear one. But it's about levels of risk. And if the public wears all the masks and there aren't enough for the healthcare providers, then we're in a really tough situation. So,
right. Yeah, the people that are putting themselves at risk and very highly likely to engage with it. Lastly, one question that I have for you is, so we understand, and maybe this is all that we can do in terms of just listening to the stay-at-home orders, but we, as the public, the non-healthcare workers, we want to do something, and you know, we're doing things like supporting small businesses or whatever, you know, by shipping goods, or you know, those, whatever we can do, but we also want to help the healthcare workers, and we want to sort of play a part in getting through this. I'm interested to hear your thoughts on what would you offer to the non-healthcare workers? What is the best things that we can do to help with this fight?
that's a tough question, but I would say the first thing you could do is just follow the recommendations that are being made in your local environment about public health measures. And if you're told to stay home, stay home. If you're told not to gather in groups, don't do that. Try to protect your family first and other people around you, because it's probably not, it might not be you. I'm not particularly worried about myself, but we're protecting the seniors and people who are chronically ill. My parents are in their mid-70s, so I'm not worried about myself, but I'm worried about them.
Thank you for the time today. Thank you for sharing your insights and your perspective on this thing, because like I said, we as non-healthcare workers, we're looking at you all, and whether we get the opportunity to say it to your face, we all say thank you to everything that you're doing. And I appreciate the time.
It's our pleasure. Thanks, everyone. Stay healthy, stay at home.
Thanks, David.